We will now be going over Chapter 13, Medical Asepsis and Infection Control. So the causes of infection basically can be caused by microorganisms. These are minuscule living bodies that cannot be seen without a microscope. Microorganisms that cause infection in humans are referred to as pathogens. They reproduce rapidly and can spread from one area of a person's body to another. Not all microorganisms are pathogenic, which means it causes disease or infection. Many microorganisms live in and on our bodies, performing needed functions to protect us from harmful pathogens, as well as helping us break down and digest food. These microorganisms are referred to as normal flora and fauna, which means the tiny plants and animals normally found in the human body. For instance, when you take an antibiotic and you end up having a yeast infection because of the antibiotic, that antibiotic killed the good bacteria, and so now you have to take something for the yeast infection, okay? All right, so different types of pathogens. We have bacteria. These are one-celled microorganisms found virtually everywhere, including the human body. Several bacteria live in the intestines to help the body digest food and absorb vitamins. They belong there. However, if these particular bacteria are introduced into the urethra and migrate to the bladder, then they will cause a urinary tract infection. With infections that are caused by bacteria, you will receive an antibiotic, okay? When you have a virus, antibiotics are useless. So antibiotics are only given for bacterial infections. Please understand that. The reason I say that is because a lot of people want to take an antibiotic if they get sick. And 90% of the time that people get sick, it's from a virus. And the more antibiotics that a person takes, the more resistant to that antibody or that antibiotic that the patient becomes. Okay, so antibiotics are not always the answer. Rickettsia is a type of bacteria, but they are different from most because they can only reproduce inside the cells of the host, similar to the way viruses must reproduce. Rickettsias are often spread by the bites of insects, such as ticks and mites, which are called vectors. V-E-C-T-O-R-S, vectors. The insects are carriers of the microorganisms, and when they bite a human becomes ill due to infection from a Rickettsia bacteria. So viruses are not made up of individual cells. Instead, they are tiny parasites that live within the cells of the host and reproduce there. Not all viruses, unlike bacteria, viruses are not endemic to the human body, and all viruses potentially cause illness. So for a virus, you can take an antiviral medication, not an antibiotic, because an antibiotic would not be effective against a virus. Protozoa are single-celled animals that live in the water. They can be ingested by humans through water and food, and when that occurs, protozoa cause intestinal illnesses. They are treated with anti-parasitic drugs. Fungi or fungus, these may be made up of one or more cells. Not all fungi require a microscope to be seen. For example, mold on bread and mushrooms growing in the yard are both examples of fungi. They can cause illness when they enter the human body through cuts or cracks in the skin. And for immunosuppressed individuals or those who are more apt to get an infection, a fungal infection can become systemic and affect the entire body. So fungal infections are treated with antifungal medications. Helminths are parasitic worms that can inhabit the digestive tract of humans. Some worms enter the body through the mouth. Once in the intestine, the worms may attach to the intestinal wall and absorb digested food, growing to great lengths. Some people take these in capsule forms to lose weight. I would never do that because that freaks me out, along with worms. So here is an example of common illnesses caused by microbes. Staphylococcus aureus, these basically cause bulls, toxic shock syndrome, osteomyelitis, and MRSA, which is a significant nosocomial infection. The treatment is antibiotics, though most strains are not killed by penicillin. And MRSA can only be killed with one antibiotic, which is vancomycin, and is not affected by any others. Strep group A causes strep throat, ear infections, scarlet fever, endocarditis. Strep group B are usually neonatal infections, especially in premature births. And of course, these are killed by antibiotics. Clostridium perfringens is gas gangrene in contaminated wounds. Gas forms bubbles in the dead tissue, and you pretty much have to amputate that limb when you get that. Clostridium difficile, also called C. diff, causes severe diarrhea, often develops with antibiotic therapy, and is called pseudomembranous enterocolitis. Only 2 antibiotics will treat this, and that's vancomycin and metronidazole. E. coli or Escherichia coli is normally found in the colon. It's actually a normal microbe. But it can cause infection if it enters the urinary tract or other parts of the body. And it is also treated with antibiotics. Here's another type of E. coli, and it is an infection of the colon causing bloody diarrhea and kidney failure, known as hemolytic uremic syndrome. Mycobacterium tuberculosis. This is literally tuberculosis. It destroys lung tissue, and drug-resistant strains are becoming more common, and it is treated by anti-tuberculosis medications. And then Borrelia burgdorferi is also called Lyme disease, and these are spirochete transmitted by deer tick to human, causing flu-like symptoms, irregular heartbeat, and possible arthritis. Treated with antibiotics. So back to rickettsia. This is Rocky Mountain spotted fever. These are spread by ticks. They cause high fever, rash, and pneumonia, and can lead to death. And it is treated by antibiotics. So getting into viruses, there is herpes simplex 3, which is shingles. Okay, so there's 3 different types of herpes. Number 1 causes fever blisters around your mouth. Type 2 causes genital herpes outbreaks. And then chickenpox is contracted first, and then the virus lies dormant in nerve endings. And if reactivated in adults, it causes shingles that result in painful blisters along the nerve pathways. So that is the 3, the varicella zoster. And it is treated with antivirals. Influenza. So this is the flu. You have aching muscles, you have fever, respiratory congestion, cough. Antiviral medications such as Tamiflu and Relenza is given, and basically the prevention is an annual flu shot. Zika virus is spread by mosquitoes. Once a person is infected, transmission can be spread from mother to unborn infant. Symptoms include fever, headache, joint pain, and muscle aches. It is treated by antipyretics, NSAIDs such as Tylenol, and fluids. Ebola is a virus transmitted through infected blood, body fluids, and large droplet respiratory secretions. You're going to provide fluids, electrolytes, and maintain oxygen saturation. The West Nile virus is a virus found in birds and spread by mosquitoes, and there is no antiviral that exists, so you have to provide supportive treatment and let the body heal itself. Fungi, Microsporum epidermophyton. This is ringworm, also known as tinea. It can be found on the skin or the scalp. It causes itchy, red, round patches. And athlete's foot is also caused by this fungus. Treatment is an antifungal. Candida albicans. These are yeast infections. It's called thrush when it's found in the mouth, but it's often found in the vagina and may result because antibiotics kill normal bacteria, allowing the overgrowth of yeast. It can also cause pneumonia and heart infections. Entamoeba histolytica. This causes severe bloody diarrhea, treated by amoebicides and antibiotics. Giardia lamblia or giardiasis, which causes diarrhea, often found in water but also may be spread through food, treated with antibiotics. These are protozoas. Plasmodium, the disease is malaria. It causes destruction of red blood cells and anemia and can lead to a severe form that affects the brain, and it is treated with antimalarials. Enterobius these are helminths. Enterobius are pinworms. They look like white threads and grow in the intestine. It is the most common parasitic worm in the United States, treated by antihelminthics. Tinea, or tapeworm, may enter humans through undercooked meat containing the worm cysts. Head of worm attaches to the wall of intestines with suckers and grows in segments, causing bloating, constipation, or diarrhea. I don't know about you, but these things freak me out. So there you go. This is going to be us for the rest of our life with this COVID stuff. Okay, so the chain of infection. So in order for infection to spread from one person to another, a chain of events must occur. This chain of events is often referred to as the chain of infection and involves the following links. Okay, think of it Think of it as the pitcher, all these links, okay? So, number one, an infectious agent. That is the causative organism. The reservoir is the place that that organism or infectious agent grows. A portal of exit or method by which the organism leaves the reservoir. A mode of transmission or vehicle by which the organism is transferred. A portal of entry or a method by which the organism enters a new host. And a susceptible host or person whose body the organism has entered. So different types of infections, a healthcare associated infection, also called an HAI. This is an infection that is acquired while the patient is being cared for in any healthcare setting, including home health care and long-term care, and of course acute care in the hospital. The single most important way to break the chain of infection and to prevent healthcare associated infections is to perform hand hygiene. I'm going to tell you this. If hand hygiene is an option in usually any test question, that's probably going to be the answer. Just going to say that for the rest of your nursing school. So, primary infections are initial infections caused by one pathogen only. Secondary infections are caused by a second different pathogen. Localized is located in one area of the body, for example, in the lungs. And then systemic is spreading throughout the bloodstream, so it's affecting all the systems. Okay? So, primary defenses against infection. The primary defenses are the first line of defenses, okay? You have the skin. The skin protects the body from microbes as long as it's intact. So if you have skin that is broken, cracked, whatever, that your primary defense has been lost. Mucous membranes. These are in the respiratory tract. These are in the urethra, in the vagina. All these mucous membranes. Basically, the membranes produce sticky mucus that traps invading pathogens. And then the gastrointestinal system. If any pathogen makes it into the stomach, the strong hydrochloric acid found in digestive juices often kills them. So that's a great thing. That would be me if I was a surgeon with my cats. So secondary defenses against infection, you have the inflammatory process. We will discuss that further in detail in chapter 26, but briefly, when an injury occurs, the white blood cells release histamine and other chemicals that cause the blood vessels near the injury to dilate. This dilation results in redness and warmth in the area of injury. The blood vessels also become more permeable to allow an increased number of white blood cells, or become more phagocytes into the injured area. These phagocytes surround the invading pathogens and eat them or consume them. So that's the inflammatory process. Elevated temperature. Okay, let's talk about this. The body responds to invading pathogens by creating an environment that is hostile to them. So the increase of body temperature to 101 degrees Fahrenheit or higher is too warm for most invading microorganisms to live and multiply. Which brings me to the question: should you treat an elevated temperature with Tylenol or ibuprofen in your children? Food for thought. So if it's like 102, 103, I would say so, because you don't want them to have febrile seizures. But if it's 99, 100, 100.9, 100.1, 100.7, something like that, just think about it. And then there is the complement cascade. When invading pathogens are detected in the body, complement is released. Complement is a group of specialized proteins that attack the pathogens by releasing chemicals that make their cell membranes rupture. So those are secondary defenses against infection. The first, remember, was skin, mucous membranes, and gastrointestinal system. The second defense is the inflammatory process, elevated temperature, and complement cascade. Now we're going to talk about the tertiary defenses. The third line of defense involves specialized white blood cells called lymphocytes that fight infection, either as B cells or T cells. These lymphocytes are found in lymph tissue such as the spleen, thymus, lymph nodes, and tonsils. They also are circulating in the blood, searching for invading pathogens, which they identify by their surface proteins. When pathogens are found, the B and T cells signal phagocytes to destroy the invaders. The B and T cells have a major role in the antigen-antibody response. So look at tertiary as the third line of defense. It's inside the body, and it's those ninja B and T cells, okay? Those are going to be what kills the pathogens. So these are just factors that decrease defenses against infection. I do want you to look over this. This is very important for you to know. So let's talk about preventing the transmission of pathogens. Standard precautions are a group of safety measures performed to prevent the transmission of pathogens found in the blood and body fluids. This includes performing hand hygiene, wearing appropriate protective equipment if exposure is possible, and using cough etiquette. Table 14.2 provides information on personal protective equipment, also known as PPE, that is needed in standard precautions. Transmission-based precautions are used to prevent the spread of known infection to patients or healthcare staff. They are used when a patient has a communicable illness that can be spread through contact, through respiratory droplets, or through the air. Gowns, gloves, masks, eye protection, and possibly head covers are used to prevent transmission of pathogens. So, medical asepsis. The term medical asepsis refers to practices performed to prevent the spread of infection. It is also sometimes described as using clean technique. Okay? These practices or techniques are basically used in every situation. Okay? You will treat each patient as if they are infected by some disease. Now, does that mean you need to go in looking like you are in the middle of the apocalypse in a hazmat suit? No. But each patient, you need to wash your hands, you need to wear gloves, you need to make sure that the environment and the equipment is clean, okay? You're never going to be able to sterilize something in medical asepsis, but you need to keep everything as infection-free as you can, okay? Sterile technique means performing procedures as those found in the operating rooms. Okay. So this is when to perform hand hygiene. Pretty much all the time. If you accidentally touch blood, body fluids, secretions, excretions, or contaminated items, immediately after removing gloves upon entering a patient's room, before the patient or tubes connected to the patient, between caring for two patients in the same room. When arriving on the nursing unit, after returning to the nursing unit from breaks or meals, after using the restroom, and anytime your hands are visibly dirty. So, airborne transmission. This occurs when infectious particles are so small and lightweight that they float in the air and can be spread through air currents. A person entering the room could possibly inhale these particles. When you care for a patient who has a suspected or confirmed communicable disease transmitted through the air, such as tuberculosis or chickenpox, you need to use additional precautions. So you will wear a specific type of face mask called an N95 respirator. And actually that's what we're wearing in the nursing home for patients who have COVID. Also, you need to review table 14.3. Some diseases can be transmitted from the respiratory system of one person to another through the small droplets that occur when a patient coughs, sneezes, or talks. When you care for a patient who has been diagnosed with a communicable disease that is spread through respiratory droplets, you would wear a mask over your mouth and nose in addition to following standard precautions. The most common path of microorganism transmission is by direct contact. This means that the microorganism spreads from one person directly to another. And then indirectly, when the person touches something, and that's how they attain the microbes. So think about the psychological aspects of transmission-based precautions. I don't know if any of you guys are working in the field right now, but I'm telling you right now, I am. And it is hard because when you are taking care of patients and you have a face shield, eye goggles, a mask over your nose and mouth, and a gown on, it's pretty psychologically distressing to patients. They can't see your facial expressions. They can't see if you're smiling. They can't see if you're frowning. But think about, and it's very uncomfortable to be wearing all these things. It is, but you have to protect yourself. So thinking about the psychological aspects of these kind of things, make sure that you spend time talking with the patient while you're in the room, okay? Ask the patient if you can bring him anything to pass the time, a magazine, a book, a word puzzle book, anything like that. And always avoid expressing distaste regarding the patient's diagnosis or having to enter an isolation room. It's not cool. It's really not cool. And then, so for MRSA and C. diff, you're going to use standard and contact precautions. So, what type of pathogens live in water? The answer is B, protozoa. An elevated temperature is a secondary defense against infection. True or false? true. It is very, very true. Okay, that's all I got for you today. You let me know if you have any questions.